There we go.
Good morning. My name is Harrison Pierce. I'm the chairman of the Health and Human Services Commission. Thank you all for attending in varying degrees of travel and illness and what have you.
Can somebody mute? Can somebody mute? I'm hearing in the background. All right, thank you.
Okay. We're good. I think the first item on the agenda is we're going to jump down to new business with commission members. And because we do have good news, we have two new commission members coming on board, Barb Ackenbaum for one and Peter Campbell for two. I am very happy that they're joining the commission and have agreed to serve, which is great. Barb is here with us, and Peter Campbell's on a business trip. He's in San Diego, loading on a early plane about now, so he will not make the meeting. He'll be here next month. Welcome, Barb. You want to give, for those of us who don't know a lot about you, just a little background?
Sure. No, Harrison asked me. First of all, it's Barb Ackenbaum. Thank you so much. I'm really looking forward to serving on the commission. Kevin and I have been talking about it for a while, and I said, well, maybe when I retire, and here I am. It's just, I see so many faces I know, so I feel like, do I really need to introduce myself? So very quickly, I grew up in Chicago. I went to Princeton. I worked in Chicago, went back to Chicago and worked at the Quaker Oats Company, where I was the brand manager of Van Camp's Pork and Beans and Captain Crunch. Don't be jealous. And then I met my husband there, and we started having children. We have 3 daughters. And so I went part-time, and I actually was executive director of a nonprofit organization in Chicago, which helped parents supported them with parents with kids with special needs. So, and that was great. And then 20 years ago, my husband was working for Unilever, and his job brought us here to Connecticut, and I was raising my kids. So I was actually just kind of a professional volunteer for about 10 years. I ran the PTA, and I was on the board of the Community Foundation and the Carriage Barn and Newcomers, a couple other organizations like that. And then I was also spending a lot of time helping my parents, my dad and mom in Chicago and my father-in-law in New York, who were dealing with the issues related to aging, and became sort of an expert on certain aspects of it based on what I was doing. So after my kids went to college, I thought, well, maybe I'll look for a job in the elder care field. And lo and behold, Tom Ferguson hired me to be the executive director of Staying Put in New Canaan, which I did for 8 years and which I loved. I just retired just a month ago. So I could spend more time with my family. I have a grandson now, and also hopefully do some travel, plan a wedding, as we discussed. So I'm just, I've really enjoyed that job. I worked with so many of you during COVID, especially. I think about Bethany and me on the phone going, who's going to shop for them? You're trying to find someone to look in on someone. And then that one day during the clinic, that memorable day when it was snowing, we had a snowstorm and there was ends out there shoveling, and Steve Benko, and we got everybody to the clinic to get their vaccinations. But it was an exciting time, and I really enjoyed working with all of you. So I'm really happy to be here now.
Thank you.
I think that's it. Yeah, I don't know. Yeah, that's it. I should mention too, I'm on the board of the Waveney Life Care Network, and also I'm the Historical Society, and I'm not taking on any more boards, just in case you. I'm really excited.
It's an impressive background and very appropriate for HHS. Okay, we'll move on to our agenda. First item is the approval of the minutes of March 3rd. Any corrections?
Jim Lisher recommends acceptance.
A second.
Okay, motion for approval. All those in favor? Aye.
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 Unanimous. Okay, reports, Health Department, Jen Eielson.
Jen Eielson, Director of Health. We'll start with vaccine data. Ages 5 to 11, first dose, we're at 72.11%. Second dose, we're at 64.83%. Ages 12 to 17, first dose, DPH data, mind you, this is old population data. So we're aware the ones that say 100, there are still a handful that really aren't vaccinated in these groups. I just have to make sure I say that because people always want to say, but I know so-and-so. Yeah, no kidding. So 12 to 17, first dose is 100%, second dose 98.95%, and third dose, first booster 55.78%. Ages 18 to 24, 100% first dose, 100% second dose, 58.68% for booster number 1, third dose. And just to be clear, we don't have data yet on the 4th dose because it literally just started last week. 25 to 44 is 100% first dose, 100% second dose. Third dose, 65.69%. 45 to 64, 97.16%. 87.87% for second dose, and third dose, 62.82%. 65 and over, we're at 100% first dose, 100% second dose, and 76.57% for third dose. Total population fully vaccinated, meaning 2 doses. They still haven't changed the definition of fully vaccinated, CDC. We're at 88.13%. Of total population with booster, meaning 3 doses, 53.21%. Total number of doses administered by the health department to date, 23,331. As I just briefly mentioned, the FDA and CDC last week approved 4th doses for those aged 50 and over. For the immune compromised, it will actually be now a 5th dose because their primary series is 3 doses. The booster that they got was already their 4th dose. So now technically they qualify for a 5th dose. And immune compromised, it's 12 and over. So it's not the 50 and over restrictions. We started administering the 4th doses last Thursday. We did 182 at that clinic. We had a large number of teachers because I partnered with Dr. Lutzy again in the public schools, and he sent out the link to all his teachers. And we're going to continue to do that. Next week they're on vacation, but keep offering it to the teachers as well, those that meet the criteria, obviously. The clinic yesterday, we had 297. We were kind of like shocked to see so many again, which is kind of nice. So we'll see. I'll send out new links tonight for next week. Yesterday was mostly 4th dose, a lot of seniors, which is good to see. And Aggie from Lapham Center reached out and offered to help, which I greatly appreciate. She's going to help with her network of seniors, of calling them, helping them sign up, because we don't have, the time and the manpower. So it's great of Aggie to offer that and help out with the seniors. So that's great. We're still doing homebound vaccinations. We did 9 on Tuesday. We have more scheduled for next week. There's no new update on the 0 to 4 vaccine. It's kind of just, they're still waiting on the data from Pfizer, and now Moderna might be getting ready to submit. So we'll see what happens. Testing update. We've done 1,503 rapid tests to date. Finally, just got another shipment of the Binax Now. That was been quite a hassle the last couple of months trying to get them. PCR testing with Progressive. We've done 922 from January 19th. This week's been a little crazy because everybody's traveling. So we had quite a bit of uptick this week with the testing. For FEP, my public health emergency preparedness update for Region 1, the anthrax tabletop training is all set for Sacred Heart University on Friday, April 29th, with all local health and our ESF8 Region 1 partners. Our New Canaan Fire Chief, Albie, is going to be the trainer. And it's one of the deliverables of our public health grant that we get from DPH and CDC. Region 1 also completed making the videos that we're going to use. It's National Public Health Week this week, and we're going to have the videos being posted with the various regional health departments, but we're also going to be using them for workforce development. The Connecticut Association of Directors of Health, Connecticut Environmental Health Association, DPH, our regional partners, the colleges and universities, and even the Nurses Association wants to use the video. So it'd be a great way to promote workforce development, because there is still a shortage of the public health qualified workforce, especially with sanitarians. So hopefully that will help, so people see what we actually do and it's not just COVID, although it feels like COVID only lately. For environmental health, the outdoor dining permits have been issued. Chris has been spending a lot of time with all the restaurants, especially on Elm Street, and making sure we have the 4-foot pedestrian ADA accessible walkway. That's why we did it the way we did, because it's got to be on the sidewalk, not in the road. The House Bill 5271 extended outdoor dining as of right through April of 2023. So that was good news. I'm very supportive of the outdoor dining, especially as things ebb and flow here with cases. It's better to get people outside. Chris is also working with Lexi and the Farmers Market. They're opening at the end of the month at the lumberyard lot. We have 14 of the 19 food vendors approved. He's still waiting on stuff from the other 5 food vendors. And Chris is also handling all the temporary food event applications, because we're beginning to get events again, which is nice, at the Carriage Barn, Waveney, wedding season coming. So it's nice to see things, coming back to life.
And when will the street barriers go back into place? Because I know that some people are starting to set up their restaurants.
They're in.
They're in
They're
now?
out.
Okay.
But they only put them where the restaurants were, because Tiger is supposed to be doing permanent bump outs, but the permanent bump outs don't help the actual restaurants because they're not located in front of the restaurants. So now the police commission and P&Z and the other boards have suggested extending the bump outs the entire side of Elm, not just what was approved. But that requires now going back before Planning and Zoning Commission and others.
What
So
about Forest Street?
they don't want it.
They don't want it. Okay.
Because it was always because that's a one-way road, and it's always an issue there with the parking anyway, and that apartment building there. So, and like Kava has a wide enough area, they don't really need it. And then Gates never had room anyway. And in the farmer's table and the diner use that little park in there. They set up picnic tables and used a little park. So, but no, we did reach out to them. I suggest everyone take a look at Elm. It looks really nice. It's nice to have the clear walkway, and it's up against the building. So it helps the retail and everything too. So last summer was kind of a nightmare weaving in and out of all of them. So we're going to stay on top of them with that. Legislative update. House Bill 5045, an act reducing lead poisoning, was introduced on March 3rd. It's one of the governor's bills and initiatives. We've had multiple calls with the governor's office and local directors of health. They're going to be lowering the action levels of elevated blood lead levels in children age 0 to 6. So previously, at 20 micrograms per deciliter, you were considered, poisoned. Anything over 5 was an elevated blood lead level. They're now lowering all the levels down to 3.5, but it's going in stages. What this means for local health is anything right now over 5 becomes a case that I deal with. Anything 5 to 10, it's just education, what spices, foods, things in the house, things like that. 10 to 19, you actually go to the house, you do a whole risk assessment. They have to get retested again. Harrison knows, as a pediatrician, it's required by statute anyway. You have to do capillary testing for children. If the capillary comes back high, which it normally does, then they have to do the actual venous blood testing. But it means for local health, an increase in workload and an increase in inspections. But I mean, on the other flip side of it is, we know lead is very detrimental to children, especially cognitive and behavioral. So we do understand that aspect of it. It's now just trying to hash it out with the governor's office about how we're going to do this. What funding are you going to give it to us? Because we can't have another unfunded mandate. And is there going to be the resources and the manpower statewide to do it? So they're going to be doing it in stages, hopefully, gradually going down in levels, hopefully to kind of offset some of that, but we'll see about the funding. The governor is pledging ARPA money, so we'll see what happens with that. There's also a large number of mental health bills out there. Jim, I gave one too, where that we're tracking, because some of them are trying to, put it onto local health to, develop programs and stuff. And right now we cannot take on more stuff. So local health is tracking a lot of this stuff to see what happens. The lead bill is pretty much a done deal, we're told. So we're getting that whether we like it or not. And I just want to, before I close, thank the New Canaan Mounted Troops. Sarah Tucker had my staff over yesterday for 90 minutes to do this horse wisdom thing. And it was really great, to not deal with COVID for 90 minutes. So we thank them for that as an appreciation. And I also want to thank Julia Stewart, Shiva Sharam, Hillary Ormond, Sarah Baker, Marley Walsh, and Shona Goldenberg. They gave us these New Canaan Loves You mugs, and we got them for all our vaccinators and our test site, and Bethany staff got them too. So that's it. Harrison, I have yours, by the way.
Thank you. I was wondering where that was. Jen, so the venipuncture, so the finger stick is the reason they go to the vein after that's contamination to rule that out.
Correct.
But does Yale still have their lead clinic? I presume they do, because New Haven through the years has been inundated with lead poisoning issues.
Yeah, and
as a source, if it's above a certain level, then you refer them.
right. And part of this bill is also what the governor's funding is supposed to help with is those, especially in the inner cities where you have most of this issue, because it's older housing stock. Anything pre-78 is essentially, assumed to be lead. And it's supposed to help with actually fixing the properties and abating the lead. Outside of Vine Cottage is lead paint. So, it's very important that it gets done correctly and it gets actually abated. So you're not repoisoning children at the same rental unit over and over and over again. So there's going to be a lot of funding to New Haven, Hartford, and Bridgeport, which have the majority of the cases to, try to correct this.
Jen, do you have the absolute numbers or percentage of positive tests in New Canaan over the last week or so?
Of the tests that we conducted ourselves?
Yeah. How are we doing overall?
This week, we're around 8% positivity with testing. The case numbers, we are around 30. So we're down. Last week we had 40. The week before we had 53, 54. So we're trending down, which is good. Oh, and then there was a lot of confusion with the parents on Monday with the school's website, because it went red because the state, the patch reported that, New Canaan's red. New Canaan's been red since like October. That's the case rate per 100,000. So it really doesn't mean anything. Our cases are actually going down, not up. And the school shows that very clearly of how many kids are positive and are not. So Brian and I discussed, about the CDC is really what we should be following, because the CDC, and he has since changed it, because the CDC uses hospitalization data, which are, at very low numbers. We're around only like 100 in all of Connecticut. They use wastewater data and deaths. So, and that's what we use for the masks, to get rid of the masks, so, but the media, of course, created a little frenzy on Monday, and, parents begin to panic. They don't want us going backwards, but we're not going backwards, I promise.
Good to hear. Thank you, Jen. Next, Bethany Zarrow, Director of Health and Human Services.
Yes, hi, Bethany Zarrow. Oh, yes, Tom?
Do we have any report on local hospitals and COVID cases? And I guess my question I'm hearing that there's supposed to be going to be an uptick in cases, and it's not too evident yet, a little bit. But I also have the impression that we have much fewer serious cases and fewer people in the hospital. But I just wondered, are we seeing that in local data here in
Yeah,
Harrison?
Tom, that's what I just was referring to, the governor's report that he does every day. There's only 100 in the hospital. That's total. So that's people that were in a car accident that just happened to test positive for COVID too. That's not actually those that are admitted for COVID. We've asked the hospital association, we're on year 3 now, for the delineate between the two, but for some reason they can't. But it's very, very low numbers.
Yeah, zero to single digits. And it has been such for the last 4 to 6 weeks.
Thank you.
And the one thing about severity, I don't know if you followed this, that, Omicron is less severe than Alpha, Beta, Gamma, Delta. The studies in Hong Kong, they're not finding this. They're finding an equal severity to Delta. And we're not seeing in this country, the explanation is that the people have either had COVID or they've been appropriately vaccinated multiple times. And it may explain why we're not seeing the same severity here that they are seeing in Hong Kong.
Yeah, but the Chinese vaccine is not very good from what I've read.
They also have very low vaccination rates because they don't trust their
Right.
government for obvious reasons.
Bethany?
Okay, Bethany Zarrow, Director of Human Services. I'm going to start, as always, the food pantry. We continue with the same about 30 shoppers, which equals about 100 individuals getting food twice a month. Police, fire, and the usual volunteers continue to pitch in, and we're very grateful for them. Blood pressure clinics, I've had an increase in number of participants, both at Schoolhouse and Lapham, with longer conversation times. So definitely it's turning into more of a rapport versus a quick assessment. So glad that's happening, and we're just extending the time frame of when we offer the blood pressure clinics. Employee programs, we are doing a restorative 15-minute massage for May as part of our wellness endeavors. We do the OSHA training next week for the DPW, for the bloodborne pathogen training. And let me see, ENZA is working on the social media roster for the fire department and police department. So that's being done. Community collaboration, our meetings and get-togethers. I go on the monthly Get About board meeting, which is next Tuesday. It's always the second Tuesday of every month. They are in the process of applying for the New Canaan Community Foundation grant. And I went to the meeting, and it was just, it's just a wonderful committee, New Canaan Community Foundation. So they had a lot of wonderful questions to ask, and hopefully, that's going along well. The rides at the Get About continue to increase. We're getting back to that pre-COVID level, which is excellent. And 2 more vans. They are purchasing 2 more vans to increase. They will retire 2 vans. They have to, but they are bringing on 2 more new ones. And so this will be able to accommodate the increase in rides. Behavioral health initiative with Silver Hill is continuing very strongly, working along the lines of having some type of quick assessment within 48 hours of someone needing behavioral health assistance, possibly. So that's in the conversations, and we've had quite a few meetings with that. Laurel House, we have put Laurel House, which is behavioral health. It does a number of things about them, from living in a community, as well as assessing people, getting them on the track, and trying to mainstream them into jobs and having a fulfilling life. So we've worked with them to go to Millport and Canaan Parish. We're deciding on once a month or every couple of weeks in order to capture those people that might not be able to come to Laurel House or contact them, going on site to see if there's a need. So that's working out. I continue to be on the SWACA advisory board and talking with the other SWACA advisory members. There definitely is an increase in senior activity in the Fairfield County Southwestern Region Agency of more Zoom, less Zoom, more on-site, and people, the seniors are definitely enjoying and participating in these less isolating Zoom meetings, getting back onto the into the community center environment. And what else? I continue to meet with the small town directors in Fairfield County, and we exchange our ideas and what we're seeing. And New Canaan is very much in line with the other smaller communities in terms of some evictions are starting now. With the gas prices going up, there is more assistance being accessed. And what else? The small town directors, we had Department of Social Services kindly did a presentation on better client experiences and easier pathways for us to be able to use to help those in need. It's a very it's a department that has such an increase or constantly helping with the federal and state programs and implementing them. To get a hold of them is quite frustrating for the client as well as for us. So that was a wonderful presentation put on by the by Fairfield Social Services. That was great.
Bethany,
And
can I just ask a question real quick?
yeah,
With the price of oil and gas going up, with the high inflation rate, I would guess,
yeah.
and for low and moderate residents that we have in town, is there any way that we could, either through group purchasing, similar to what we do here at Waveney, we hedge the market for a period of time and get reduced rates from Eversource, Constellation? There's a lot of companies
Yeah.
out there. Have we ever thought about for, New Canaan Parish or any other,
We
grouping?
can't, that would, I mean, it's a good question. We can't store energy, but with the energy assistance programs that the state and federal have, we apply our clients to that, and their awards that they get each season, we can apply it to that. The town does have their own oil that they do. And in the event of a crisis or someone is out of oil, we can't get one, they will go and give 100 gallons, and then Human Services will be charged.
Yeah, no,
But-
I wasn't thinking in terms of actually, storing energy or storing gas or fuel. But you can actually go and get a consortium of companies together, a consortium of people together, and you can go to the market and hedge so that, instead of paying, 20 cents per kilowatt hour, you're only paying 8 cents per kilowatt
Yeah.
hour, and you can go under contract. So I didn't know if that was something that, we should put
That
on
is
the
not
table for the
something,
town.
yeah, that's not something Human Services has done. It's best to stay out of that in terms of issues with people.
I hear you. Yeah, I just
It's
didn't
a
know if
great
it could save
idea,
some.
but we can't run the energy. And then if they get awarded, yeah, it's I think it's one more piece that would add to the complication of streamlining it for the town. So I think sticking with our federal programs.
Yeah, maybe it's something more for Scott Hobbs or someone like that.
So through HUD, it might be.
Yeah,
Yeah,
okay.
the social services, DSS, which we have to follow, we follow their energy fuel help assistance. We have to go through that process.
Okay, thank you.
That'd be great. And then also Jackie's going to explain the divorce support group that she has been collaborating with. She'll go on and explain that. The other thing, unfortunately, there were 2 suicides in Darien. within a 24-hour period last week. And so I did call together our postvention and crisis team because we are so close and neighboring the town, and we had a lot of crossovers with lacrosse players, and there could be some type. We wanted to make sure that we could decrease and prevent a potential contagion trigger. So we had a meeting, we initiated a meeting, and the takeaway that we got from that, we are going to look at researching mental health first aid training again. The pushback from that was it's an 8-hour course, and it's very difficult for people to take a day off with pay or 2 4-hour classes. We're trying to find a way to see if there is a shorter program that can cover, even though it's such an important program, sort of a synopsis type in order to get more people. That's usually what happens is there's a low turnout because of the time commitment. So we're working on that. Andrew Gerber, the head of Silver Hill, who is on the crisis team, and head of Silver Hill, he is seeking best practices for a contagion response. So if we do have a contagion response, even though we've tried to decrease one, he's talking to a colleague of his at Columbia University who's a specialist in this. So we'll be getting more feedback for the crisis team to see what to do and have a plan in the event that that happens. In response directly to the Darien tragedies, we have posted some public service announcement flyers that Darien had disseminated. We put those on Instagram and Facebook and gave them to New Canaan Advertiser and New Canaanite to see if they could post those. But we just sent out a PSA, not really going into a lot, but letting them know that there are resources. And we also reached out to Darien Human Services. Marcy and I, they were in need of coverage on Saturday and Sunday at Town Hall, potentially if families or someone came in for some type of counseling. So Marcy and I went there over the weekend, and we are also partnering with Darien and the Family Centers, Center for Hope. We are tomorrow having a community conversation, Zoom only, on loss and grief, which is 10 a.m. tomorrow morning. We have posted that throughout and sent that, disseminated Darien and New Canaan. Anyone's invited, and hopefully, the word's gotten out. And if we have one person or 100 people, it doesn't matter. Hopefully, if we just help one person. So we thought the loss and grief, we have had a lot of that in both towns in the past 6 months, and we want to acknowledge that. Lastly, our monthly stats, we're really pretty much the same. We continue to have, there's been a little bit of an increase, but we have about 180 adult seniors that Marcy is working with, and about 150 individuals, which is about 90 families that Jackie's working with. Domestic violence, last quarter, we had 6 domestic violence. This quarter, meaning January, February, and March, we've had 11. So, Jackie's been busy with that. And our total energy assistance families that have come to us for help, that's 30 families, but that doesn't mean they haven't gone directly to the Connecticut Western Community Action to deal directly with them. It's much faster for them to do it that way. So, but we've had at least 30 requiring assistance. And Marcy and Jackie and Enza continue their incredible dedication to helping those in need. Lots of thank yous to them. Cases are taking longer for many reasons, but primarily because of the condition of the situation when we are called in. There's a lot more complications and untangling and getting the correct resources. Getting the resources, that's not hard at all, but it's just in terms of compliance and things like that with the client, just finally accepting and admitting to what they need to work on. And and also they're just digging as deep as they can into the resolutions, and the goal is to increase the chances of a more positive outcome for each individual. Tom.
Bethany, could you or Jackie briefly describe that process that you said is, can be complicated?
Yeah, you know what? When Jackie and Marcy do their report,
Thank you.
yes, I'm done. And yeah, exactly. We can feed right into that. So
Just
thank
brief.
you, everybody.
Thank you.
Muted. Bethany, I just want, thank you. What an amazing report. You guys are busy. I just wanted to back up to the Get About because I think it's fantastic that they're going to get 2 new vans. That's going to make a real difference for people. Can I just ask you who funded that? Who's funding that?
So one very generous donor who wants to remain anonymous
Wow.
purchased one. The other one is funds from the Get About.
Okay. Well,
Okay, I've also put in ARPA funds for another van. These vans do not last long. They are with the roads, going to Norwalk, Stamford, Darien, and around here. They last for maybe 4 to 6 years.
Yeah.
And the rusting and the sitting out. It's interesting, just the town driving, it is just really harsh on these vans. But they've got a good group of drivers. The residents are so appreciative, and
It's going to be great.
yeah.
Thank you, Bethany. Marcy Rand, Dalton Senior Services.
Good morning. Thank you. As Harrison said, and Marcy Rand. To start off with what Bethany sort of finished with, I just finished up a conservatorship for a resident who is now going to be safe and having her needs met. A lot of my cases that include protective services and conservatorships are cases of self-neglect, and it just results in being a danger to themselves. And so unfortunately, sometimes that ends in a conservatorship, but it's always for the best. And as I said, I just finished up one of those. I'm continuing to work with Adult Protective Services on referrals with them. As well as along with like planned visits, I've been stopping by at Lapham just to get people comfortable with me. Coffee with a Cop at Lapham had 17 in attendance last month. And then this month on the 14th, Kelly McLaughlin, Officer McLaughlin, will be covering scams. We had pizza with the schoolhouse residents and the police, and that was fantastic. There were 22 schoolhouse residents. There were 6 police officers, and there was talk of having it again outside in the spring. So it was really nice for everyone to get to know each other a little bit better. My Life Reimagined group with Robin Rockefeller has been also really well received. We're thrilled about that. That has gotten so popular. It is now twice a month, and we are having one today at 1 o'clock. So there was obviously a need for just people connecting with each other and peers, getting to know peers. So that's going to be twice a month. And my renter's rebate is beginning. I think that begins on Monday, the 11th. And I'm sure to be getting lots of applications for that as well. And then, although I only had one energy assistance application this past month, I think with the move next year, energy assistance applications will increase. The move was not done in December, so we haven't had a lot of months of need for heat yet over in the apartments, but next year they are heating with propane and natural gas. And I think that next year will be a different story. And to answer a little bit, Russ asked about the energy and pooling that. This year, energy assistance, anyone who did apply and was granted something, they were also provided with a $700 credit to electricity, which was super helpful because electricity has gotten super expensive as well. And
well, Marcy, I just want to thank you and your team. I know there's been an increase in adult protective services in our town, and I think you've been working very well with our home care division in a couple cases that got identified. So privately, just want to thank you for that.
Thank you. Thanks.
Yeah, I just want to say, yeah, Waveney's been great in terms of contacting them. The response time, which that's part of why things take so long, is waiting for a response. I mean, Waveney has been incredible. I just, one more reason why we're so, grateful you're here. Thank you.
Marcy, just in response to or answering Tom's question about the time consumption, et cetera, can you just quickly explain the conservatorship and what that entails?
Well, it's a lot, it's not done lightly. So there are multiple home visits, there are psychiatric evaluations, there are medical evaluations, and then there really is an assessment for a need, because no one wants to conserve somebody, for not really strong reasons, because these reasons are usually that there's a cognitive decline that doesn't allow them to care for themselves correctly or safely. And it seems like that is the case with most of our protective services calls for the, for the seniors.
Thank you.
Yep.
Youth and Family Services, Jackie DeLuey.
Yeah, hi everyone. I'm Jacqueline DeLuey, the Youth and Family Services Coordinator for the town. It's good to see everyone today. So this time of year, very busy with camp and pool referrals. For those that are new and don't know the process, we can assess a family situation and decide the pool pass is $455 normally, but we can ask for a reduced rate on that if we feel that they qualify. The lowest we can do that for is $150 for a family for the summer, so that's great. We also can see if Waveney Day Camp and then their younger kids camp, we can get a discount on those as well. Work with the rec department on that. Sometimes we can offer assistance. We definitely want the family to have buy-in as well. So that's, more importantly, hoping that they can budget for that so they have the money to put towards that, because those things are very expensive. And then if they were to go to the Y, they do their own financial aid there. So they come up with that figure for the family. So that makes it easy too. So again, that's, lots of requests for that. And we will just keep having more of those. I don't really want to get into like family specifics, what Tom was saying, just because, this is recorded, but I think when we go to help a family, I've had a lot of families with like housing issues, and in the past, historically, we don't really, if it's at Canaan Parish or Millport, we don't really want to get involved with the housing because we're working with so many people, and literally we probably need to get involved with every single one. But there have been some that we've had to, whether it's been a communication issue. I've had some anxious families that were not hearing back, and it did get the ball moving quicker when I did intervene, which was nice, but kind of a bummer for families not to get the response that I would get. I don't like to see that at all. But yeah, and a lot of families still seeing people with like back rent, that rent hadn't been like either assessed correctly, and then leaving a family that they don't make any more income, but now they're seeing that they've got to pay all this back rent. Like that's tricky. So we've either had to assist or help them look into, sort of that, if that's correct, and help them look over, like they get a ledger of what they pay, and we try to help them there. Again, I feel like I needed an MBA for this, like part of the job, but it's great. It's good to learn. I wish there were more. If anyone has any options, a lot of families having budgeting issues, and that's always been an issue. Catholic Charities in Norwalk does a program, but only contingent on if you're asking for a loan. So if you're asking for a loan to buy a car or something like that, then they work with the family on the budgeting. But I have families that just aren't able to budget if they don't need a loan. So if anyone ever, we had a program years ago that I mentioned that was the United Way funded program, and it was volunteers from like UBS and has since dissolved, but it would be very helpful because I'm seeing a lot of credit card debt. Maybe that was from the pandemic. I try to inquire. Some people aren't, as comfortable to kind of share what the reasonings are, or they're taking out cash on the credit cards to use, but then we all know the interest rates on that is ridiculous. So that's been tough to see. I've worked closely on a few cases. The Teen Talk counselor and I, Greg Sloan, that you all have met, on a case. We had a student that, there was pretty significant vaping use. And when talking with the family, they sort of felt like there were mental health issues as well. And they didn't have great insurance. And I'll tell you what, it was really tricky because Silver Hill wasn't an option. I looked at some other private, there's one in Southbury, Turnbridge, that was going to be like $2,000 a day. I mean, for a family that doesn't have great insurance, they can't pay that. Four Winds was an option, but if anyone is familiar with that program, can be pretty clinically shocking for a student to like go in. I mean, they remove shoelaces. I mean, it's very, and I wasn't aware that this child had any suicidal ideations, thankfully, but it was a pretty shocking thing. We're hoping now to get an in-home program. There are some pretty intensive in-home programs that work, but there's wait lists. So the person is on the wait list for that. One way that could open up a program is if a family works with the Department of Children and Family, and for obvious reasons, families are really hesitant to do that because they think they're admitting they're not being a good parent. But what I always tell them is like they have they have programs for their kids, so it gives them a slot to get in that program quicker. And they really want to support families, but people are still very nervous to work with DCF. But again, we don't have places to put kids, so the plan would never be to remove a child if they didn't have to, because there are no places to go. Kids in Crisis was also an option too for this family. What they do is kids can go into shelter there, and the clinicians at Kids in Crisis will work with the family on a plan to get the child back home and have communications run smoother. So that's a great option there. But also working like closely with the police. I've had a couple of referrals for even minors where the families had an interaction with the police and then is needed a counseling referral for some pretty significant stuff. And I had one mom that was so thankful that I called her and reached out. It was like last Friday, and I didn't want the weekend to pass without getting her some contacts. And, I told her I'm also a support, to them as well. And she was so thankful for that. The other one was a pretty significant like conduct disorder for a student that would be aging out. So at that point, there'd be less options that the family would have. So hopefully those referrals will be taken seriously and that person can get connected. I have worked with SACS on a bunch of cases. Like there's just been more and more. Alicia and I got to go to this. Did anyone have a question? Sorry, before I move.
I have a question
No?
or a
Okay,
comment, actually. Low-income financial planning. The Open Door organization is getting ready to open within the next 2 or 3 months, a financial planning center in South Norwalk for low-income folks.
Okay.
And we already got the funding to do that. So that's going to be
Oh,
helpful.
that's great.
Yeah.
Yeah, the
Jack-
minute that gets going, please tell me.
Jackie, thank you for a very in-depth, gives me an understanding of the difficult issues you're dealing with. Do you find that most of the families you help have financial problems, or are you finding as many families who are financially okay, but still have serious concerns with their families or children?
I think it's both. I mean, I think historically, like people know us as, because we run a food pantry, we can offer some financial assistance or discounts at the rec department and various places. But, so families will come to us for that. And we have some that their situation doesn't get better, so they're needing those services year after year. But then we definitely have the clients that call us, that we get connected through the school that, sometimes there's a financial need, but I think sometimes it's that maybe the school has offered many resources and the family hasn't taken it. And their hope is that maybe if I connect with them, they'll hear it again. Because what we know about, these services is when the person is ready to kind of hear about that service, it may be at the time of crisis, that they're willing to get in contact, but it's just helpful for us to kind of, yes, I think there's always issues with kids navigating that. So it doesn't always have to be a financial need. I think I'm always talking with families, daily about different things, or kids that have special needs or need more programs, and finding sort of, those resources for those families.
And Bethany, thank you, Jackie, for.
And then I'll quick.
Bethany, I'd make a motion to please upgrade her speaker system. Do I hear a
It's her
second? Do I
office.
hear a second motion?
Yeah,
I've got it in my
Okay,
notes here.
all in favor? Aye.
yeah, I know
Aye.
you guys, it's Jackie's office. There's something, IT has been in there over and over again. So I know. Maybe Jackie will have you in another room. the
I
next-
can sit out on the meetings.
Jackie,
I'll
we
just
got
give
all
you
the information.
A written report.
We got all the information. Thank you.
Okay.
But there was static through a lot of it.
Yeah.
Well,
So
I also
Jackie-
wanted to say thank you to Jackie for, she's been a part of some really good programming for parents of teens recently. There was one at the high school on parenting teens on like sex issues and the internet, which was very informative and very helpful, and a whole new horizon for parents, because this is like nothing we knew as children, as teenagers. And then also really, really well done training session for how to parent and be an ally to LGBTQIA teens. That was very, very well done and very helpful. So thank you to Jackie for those, and all kinds of new issues, and it was super helpful too. I got lots of really good feedback from people on those, Jackie.
No,
That's great.
It was amazing. I know no one can hear me, but I will say that we still have not locked down a teen talk counselor yet for SACS. I think there were some people that were good and for whatever reason, but I will urge them that I think if they do hire anyone, that person has the LGBTQIA, background, because I think that's huge. I think SACS is seeing a huge, and it's tricky at that age with parents. I think it gets a little easier in the high school, but there is a need there at SACS. So I do think that bringing someone in that's got, comfortability with that, I think that would be amazing. So I will urge kids in crisis to look for someone that's, since we are still looking, we can certainly look for that.
Yeah. Jackie, along
But
those
one
same-
last program I want to mention. Yep.
Go ahead. Well, go ahead. You can mention it.
No, one last program on April 20th at 7 p.m. at the SACS Auditorium. If you can come out, it's Dr. Rob Teresi. It's myself, Silver Hill, and New Canaan Cares partnering. It's Alcohol Awareness Month, and this topic is what to teach kids and when about alcohol. A huge, important topic. Please come if you can. We hope to fill that auditorium. So that's, again, April 20th at 7 p.m. at SACS. Thank you, everyone.
Yeah,
Thank you,
you-
Jack.
Thank you.
Great.
A couple of things, just follow up on that. Jackie, your monthly newsletter is just full of information in terms of entertainment for kids, families, as well as education, including mental health. So that's, it's important to continue to distribute that to the community. I hope people take advantage of it. And the other thing, was very nice meeting Greg Sloan, who presented last month at our Zoom and monthly meeting. He's very well thought of and liked at the high school, and you can see why, and it's great to have him there. And Bethany and I were in communication via email. I did think that Kids in Crisis was very close to hiring someone. I thought they had, but you know, then have you heard anything, Bethany, that?
No,
they
and
had
I
a
was reading
candidate
that
who's
last
interested, et
email.
cetera?
Yeah, no, I
Yeah.
was looking for the follow-up to that last email and there wasn't
I-
one.
Yeah,
And
that was a couple of
I
weeks
had
ago. I thought they had
spoken,
some-
Jackie, yeah, what did you
I
hear?
had spoken to Ellen. I think I had reached out to Ellen Brzezowski, who's now with Silver Hill, for a case that I was working on, needing a resource. And I mentioned it and she said, I think at the last part, the school came back and they had some information, and I think that that's what deterred the hiring of that person. So it was close, and then that's what happened. So that's
Alyssa McKenzie, Commissioner, if I could just add one more thing that Jackie does that's so amazing is she invited me to attend, I think she invited all of us actually to attend the second Thursday of the month, the Abuse Prevention Partnership. And if anyone ever has time, it's at 8:30 to join. It really gives you like just the best overview of the work that so many organizations are collaborating on. I can't speak to how wonderful it is to have something that like that in town, and to be a part of it and hear what's going on is just so impressive and honestly inspiring to get more involved in the town.
Thank you. And that reminds me, the divorce support. I will have the most detailed information for you when it's available. We are close to locking in a family centers clinician, hopefully to start the first week of May at the Congregational Church for probably a 10 a.m. morning during the week. We're just working with the church on what day would be best. And that would be weekly, and any, mom in town in need of that. I think I probably have 3 that could start attending, and I think they're fine to go with, obviously, more could join that. So once I have that all locked down, you guys will be the first to know.
Jackie, can you send out the link again for the abuse partnership?
Of course, I'll send you an invite. Absolutely. Thank you.
Thank you, Jackie.
Yeah.
Next item, old business, the American Rescue Plan Act. So number one is, with the money from ARPA, we were looking at mental health things related to COVID, which the ARPA fund that's what it's supposed to be doing, amongst other things related to COVID. But so this was either Kevin, our first selectman's brainchild in conjunction with Dr. Gerber, but is initially to finance those in need of mental health who could not afford it, and in collaboration with Silver Hill. And that morphed into an acute diagnostic center, urgent care, the name to be determined, but it's going ahead. I think it's a great idea where someone would be ideally available 24/7. I think they've weaned it down to 24/6, but to provide acute care for someone in need, whether they can afford it or not, some of the ARPA funds would cover that expense. So this is still in process, but it's going to happen. And I think it's great for the community. Kevin has spoken to Darien. They're interested in coming aboard. There have been X number of meetings with people from different towns attending too. So Darien, I think, is a definite as of now, and they would contribute some of their ARPA funding too financially. Kevin is speaking to, and maybe Dr. Gerber also, to Wilton and Ridgefield to see how this all settles in, but it's a go. There's going to be $250K funding from New Canaan's ARPA fund going to Silver Hill to establish this acute diagnostic urgent care service. And personally, having practiced in the area for X number of years, I think it's great to have the service available, and hopefully it'll be very successful. People will use it in town, out of town. It depends how it's marketed. It depends how well they support it, and the quality issue too. But I think it's a definite go.
Harrison, it's
yes.
Penny. It still has to go through the approval process. So, and I'm not saying that there are going to be problems, but I wouldn't speak as it is going to happen. It is in process and a very positive direction.
Okay, I was given a more positive
Well,
report on that. Okay, Thank you.
We're meeting tonight, actually,
Okay.
so for one
Um,
step of it.
So that was one item on the American Rescue Plan Act, and the second one is Waveney. So I think Russ presented something to the committees in town, and I think it's probably not an absolute yet, but is somewhat in process. I don't know if Russ wants to speak to that. I will. I'll say something and they can counter. I did read through it, the presentation yesterday. And in all due respect to Russ and Jim, I have a different perspective, and a lot of it had to do with telehealth and some of the other things. And just give you a little backdrop that there's a clinical person in town who is a nurse by education and practice, and also a malpractice lawyer who defends physicians. And she has been going around speaking to hospitals and medical groups about the pitfalls of telemedicine, telehealth. And I unfortunately heard about an unfortunate example about a month ago, just at a high school hockey thing with the granddaughter, where the person I knew was carrying flowers, not to over dramatize it, but I thought, and she's in a position where she does help kids who are interested in colleges and sports, et cetera. She was quite an athlete herself. And she relayed the story about someone who is otherwise healthy 50-year-old who was via telemedicine, got on the Zoom, complained about shoulder pain, and was told to, given the name of a physical therapist, et cetera, and he died that night from a heart attack, myocardial infarction. You can pick these examples out from everywhere, and it doesn't state everything, but there are so many risks laden with this thing to create more of it and to fragment the delivery of care somewhat. It's great when people can't get it, and that's the only option, but short of that, not sure it's the way to go. But anyway, enough said for that. It's probably a much longer discussion. And
yeah, that's unfortunate, Harrison, that you take this moment in the platform as a chairman to have that position without further discussion on
well,
it. As if you'd read through the full application, you would have seen that this isn't just a Zoom call and a telehealth program. This is a telemedicine where stereo strips can be applied, where not stereo strips, where rhythm strips can be applied, where EKGs can be read through, and certainly it is not to prevent urgent care, but it is used to monitor patients who are at high risk. Congestive heart failure being an example. As we know, adding weight and fluid, so for someone to be able to monitor their weight is important. For someone at the other end of the scale to be monitoring their weight gain over a period of time, people's blood pressure, other chronic ailments. So it's not to be used as an acute intervention or an emergency department, but to be able to monitor chronic illnesses. And it has been well accepted throughout the country. And for you to bring up one or two anecdotal cases, liability cases, I think is unfortunate.
Well, it's just an example, because that was a shocker, but it underlines. And the reason I presented this morning, number one, our first selectman did want me to bring this up, both the Silver Hill as well as the Waveney proposals. And I just received your presentation on the request for funding yesterday afternoon. So I read through it, and that was my response. I thought it should be discussed. I'm not sure there have been, that it's been fully aired, the presentation, and who was involved in making these decisions. So
Harrison, can I say
Amen.
something? Harrison.
For a major defense, I'll just tell you that telehealth is coming regardless, and all the legal issues are being resolved as all the way up through CMS. Medicare and Medicaid is now going to be reimbursing telehealth monitoring and healthcare, both behavioral care and medical. The other comment quickly is that visiting nurse of Fairfield, which is now part of Waveney, has been doing medical management at home with home care people for many years. I don't know of any problems so far, but bottom line is it's going to be part of the woodwork. We just need to work out the details.
No, I'm not saying that there's not a role for telehealth or telemedicine. There is, but given options, it's like the last resort, probably. And when you look at everyone, like I think Russ, you stated in your proposal that everyone would opt to go for telehealth and telemedicine. Yes, that's 69%, whatever number you stated. And there's some truth to that because it's easier. I mean, you can stay at home and do whatever, but in terms of clinical effectiveness, et cetera, when I say there are no other options, it's a good thing. But when there are, to bypass the kind of the standard, hands on the tummy, stethoscope, et cetera. And I know that's not, you will not advocate that per se, but it's inherent in the whole telemedicine, telehealth thing.
All right.
Harrison, can I say something?
Sure.
So it took me 2 months to understand telemedicine as Waveney is putting forth. There's been a great evolution because of COVID about treating people who are homebound, and Waveney went into home health care 5, 7, 8 years ago. It's a critical, Waveney is an important medical institution in town. And with the merger with visiting nurses, visiting nurses, as Jim said, has been doing this for years. But now the important difference is the insurance and the Medicare and Medicaid will pay for it. And it's an evolution and that's probably the critical thing. It's a way of delivering care more efficiently for ongoing cases. And by the way, this will be focused on our seniors because most of our ambulance rides to the hospitals are seniors, and the ability to have someone's medical records entirely on a tablet, that when they get to the emergency room, they know exactly what meds they're on and exactly what their history is. So I think this has great benefits, and it took me a while to be convinced myself, but I think the town council and board of finance subcommittees will be looking at this. And I urge people to watch Russ's presentation to the board of selectmen the other day. And so I think this, this is where we're going in terms of improved healthcare for seniors, especially who are homebound or otherwise need continual monitoring. So,
well, the electric record, that's available anyway, and that's just standard procedure when someone goes to the emergency room. They do have access to their records.
That is absolutely not true, Harrison.
If you're in the Yale system or Stanford, yeah. But
that's absolutely not true, Harrison.
Yeah. That's why the EMS people actually, like this idea. They try to gather the information so that the emergency room doctors know what they're dealing with, and but this provides it automatically. So you got to dig into the detail to understand exactly what Russ is proposing.
Yeah. Now, Russ, if people have physicians, they are communicated with and they get the records. If they don't have a physician, that's another story.
Well,
then you're correct.
Harrison, again, we can go into a lot. We could speak about 2 hours about telemedicine and developments right now.
At least
the truth of the matter is that most clients, especially seniors, have multiple physicians, and you can go to a physician and not have your same medications on all of the charts that the physicians have, and they haven't been updated, especially if you have specialists. You can be taken to Stanford Hospital and you have a Norwalk physician and not have your medications on record, on file. So I urge you before coming out into a public forum and as chairman, as your position of chairman, to spend a little bit more time understanding what's being proposed in the level of telemedicine, the delays that seniors have in getting into a doctor's office right now can take up to 2 weeks in terms of an appointment. We're not talking about having a Zoom call with a doc in a box or a teledoc. We're talking about actual monitoring of patients, clients, residents who have chronic ailments, monitoring those, and if there are variations, to get in touch with their physician that they've appointed and having those records be available to the emergency department should they choose to go there. So I'm sorry that you've taken this opportunity to state your personal opinion in this forum, and I'm hopeful that you will take the time. I'm glad to have a meeting and provide as much detail as you need. Telemedicine is something that we've been utilizing at the visiting nurse for quite some time, and we've found it to be cost effective. We found it to be improve the quality of care. There have never been any liability issues whatsoever, and the physicians have been extraordinarily happy with utilization of it. So I'll leave it at that.
Alyssa McKenzie, again, Commissioner. I, as someone who is disabled and chronically ill and has a huge team of doctors that are across the country, I can speak to, if anyone is interested in discussing my accessing care locally. It's been pretty difficult, but about 20 years ago, they had telehealth, insurance was covering it, and then they stopped covering it. So I can also speak to my sister has a seizure disorder, and so her doctors in Boston and Cleveland were able to actually see her seizures in real time, whereas accessing appointment 6 months, a year out, she wouldn't necessarily be having a seizure at the appointment. And then in the last 2 months, caring for my grandmother, having the telemedicine, having the blood pressure cuff, having the scale, that was so crucial in her having the best quality of life in her last 2 months. So if anyone wants to have a discussion on how I've seen telehealth and telemedicine work really successfully for all ages and all different issues, I'd be absolutely happy. That's sort of where my advocacy work lives anywhere. But I agree, like my grandmother's care was all in Stamford, but when she was unresponsive, she'd be taken to Norwalk, and you're kind of back at the drawing board in terms of all of your medications and your medical history, which is tricky during COVID when you're not allowed an advocate unless you apply to get one, which can take an hour. That hour is a really crucial period of time where she's alone and not able to communicate necessarily due to dementia.
Thank you,
Well said.
Alyssa. I just want to say something that neither here nor there in terms of the opinions, but I think everybody on the commission has a right for an opinion and for it to be respected. And I thank Harrison for giving his input, because we do need different inputs in order to come to a decision. So I want to support Harrison's opinion, whether it, whatever the opinions are. I really want to make sure that we can discuss them without any type of tension or comments. That's all I have to say.
No, no, please don't mistake anything that I said. I respect Harrison's opinion. I think that it would have been nice to have an open discussion, and if there were questions on the process or the application or the implementation of it, using Alyssa's example, there are 1,000 examples out there where it's been effective. So
Yeah, but
I
we're
was
having
hoping
that
for an
discussion.
open, I was open for an more open discussion. That was my only point.
Okay,
The topic was delivered, and I presented one aspect to it, and you presented another, and Alyssa hers, which is fine. I mean, this is what we're doing here.
Could I?
We are a Health and Human Services Commission. People in town wonder what we do and why we're not involved in this decision, that decision, et cetera. So when you see an implementation or distribution of ARPA funding, and they will say, did you discuss that? Say, no. No, we weren't involved in that. We're presented where they're going, at least in terms of the two health related things, both at Silver Hill and Waveney. And, so it's open for discussion.
Harrison,
and that was what we're doing.
That's a fair criticism. This didn't arise from Human Services. This is something that had been proposed. And the Board of Selectmen is trying to move these things forward. We time, but I, since COVID is a key part of our, this seems like the classic thing moving health-related funds to support it. So, but I think if people want vetting, it's time to do that. We don't need to rush this.
I just,
Kevin, we need to fix your Zoom also.
could I make just a comment here?
Yes.
I know that the Waveney proposal was very, very carefully put together, and you can tell that obviously when you read through it. The example that Harrison cited was a serious problem, was a serious case. And something didn't go right in that example. And I guess the question is, in instances like that, how do we, in a telemedicine world, prevent that from happening? And my guess is there's a way to do it. I don't want to get into clinical stuff because that's not my thing. But I think there needs to be a discussion of that kind of example and how you prevent it. And I'm sure there's an answer. But anyway, I'll stop.
Well, similar to that, I mean, if we wanted to talk about the Silver Hill proposal and put more detailed discussion into that and how many cases that are built into the proposal, we could have an open discussion, an open forum on that as well, because there is a limitation on the number of clientele that's built into the pro forma, into the funding. I believe it is 5 per week. So I don't know if we have done a need and demand analysis. The commission has, and determined whether or not 5 is an adequate number or if it needs to be higher or lower. I don't know if that vetting has taken place by the commission.
It's been discussed, but it's going to be a TBD determination. You don't know what the future brings. You're going to establish the acute diagnostic clinic and market it and make physicians and potential patients aware of it, families, and see how it is utilized. Because there are a lot of.
If we exceed 5 and we exceed the budget, is there alternative financing for that program and support?
I'll let Kevin answer that because he is speaking. Are you still on, Kevin?
I think we lost all of town hall.
We may have. Let me see. Good. Thank you, Alyssa. We did
Welcome.
lose everyone.
Probably due to the 10 o'clock witching hour. I don't know. But, something.
Yeah. Okay. Listen, thank you for all participating. I think it's good to air these things out.
Yeah.
And
I want to,
again, welcome, Barb. Great to have you on board.
I would like to bring up the second part of the Waveney thing besides telehealth is the Cna School, which is a very innovative way of solving a major problem statewide, locally, statewide, and nationally of getting healthcare staff. And I know for a fact, having just talked to them yesterday, that it's very close to being looked at the governor's workforce strategy group. And I'm hoping that that plus the town support will be very helpful. But that's a critical piece for generating 100 CNAs a year in a very innovative way that Russ has put together. So you should we don't have time to discuss it, but you should take a look at it at your leisure if you're on the commission.
Thank you, Jim. It is time, so I think, may I have a motion to adjourn? All in favor?
Okay.
Thank you. So thank you for everyone for participating. Our next meeting, May 5th. It will be, again, TBD, hopefully in person, and then we can continue on with our discussions. Have a great month and welcome spring.
Great. Bye-bye.
And
Bye.
yeah, if you can each
Bye.
sign yourself out, because Bethany usually does this, but I think that with a non-functioning town hall, it's not gonna happen.
Well, perfect. Bye.